Good afternoon, everyone. Time for our media briefing. Happy Monday to you. For those of you who usually watch on our YouTube channel, we're having a little trouble connecting for the live stream, but after the media briefing is over, we'll upload it to YouTube for you. We're going to get started today with Under Sheriff John Minot, who's going to give us an update on COVID testing at the jail. Thanks very much, Under Sheriff, for joining us.
Good morning, Maya. Good morning, everyone. I'm going to, Maya, do I have the ability to share my screen?
Surely.
Okay.
It all depends on if you have the ability to share your screen.
I have. I want to take, do you by chance, Maya, have the daily situational report?
I don't have it available, but most of our media who is on the call will have received it by now.
Okay, I want to get to that real quick. I'm sorry, I thought I had it right here handy, and it is failing me because I want to show everyone the updated numbers and talk just for a second about what we're doing and what our numbers look like. So. I apologize. I hope everyone in the media has got the updated sheet. We do have, obviously, we test even throughout the weekend. So our newest report that came out today, we have a total of our inmate population is at 714, and our total tests conducted on inmates so far is 944. Our total confirmed cases are 279. Our total current cases are 166. So just for everyone watching and listening here today, for us, it's there's been some comparisons made for us versus, say, the Department of Corrections when we talk about folks that have recovered. And it's a little more difficult for us to challenge or to track just because our inmate population is so much more transient in comparison to CDCR, and so they're actively reporting total number of cases recovered. It's a little more challenging for us because, frankly, if somebody tested positive today, but their release date was tomorrow, then once they're back out in the community, their health condition really isn't any of our business anymore. So it's tougher for us to report on the total number recovered. So what we're left with is total active cases in the jail. So again, 279 total confirmed cases. And there are currently 166 active cases in the jail. And again, that's a combination of folks that have recovered because they're still here. They've gone through the duration of ridden out the virus in our jail, and then those that were also released. So that is all going out in the EOC's daily situational report now. That's as far as the active cases, that's new. We were working on that last week. So anyone that gets that can see the total tests and the total active cases. So I'd be happy to answer any questions.
Thank you for that. And then we have Dr. Moreno on the line, but he's going to just answer questions that you may have. So we're just going to start with questions, even though there aren't any in the chat. If someone wants to either add to the chat, which miraculously one just showed up, or you can just ask them at will if you wish. We'll go ahead and start with the one that I just received, and this is one for you, Under Sheriff. How many jail inmates who have been tested positive or have tested positive have been released into the community, and how many have moved to alternate housing, and where? Is that housing voluntary?
So, Maya, we work very closely with the health department on and with the EOC on releases. So really the trick is, or the key is, does somebody have the ability once they leave jail to isolate and to be somewhere where they're safe from not infecting others? So if they have that ability, they could be released and go right back home. If they don't have the ability, then we've worked with the EOC to find placement for them so they can go and isolate until the virus runs its course. And then you'll have to forgive me. I'm going to need to look real quick. If you look on again to the daily situation report, it shows that there are 20 in the alternative housing, and then you'll have to bear with me as we move through this. I'll look and see how many have been released that were positive, and I can post that in the chat.
Thank you. And then another question for you. How many hospitalizations have you had in the jail or related to jail clients, including those discharged and maybe back in the jail? Kind of the whole scope.
4 that went to the hospital, but they all came back. They're not still currently hospitalized. They were released. They came back to custody.
Okay. What are the latest jail employee COVID-19 figures?
I'll pull that and I'll post it to the chat. I think we're at 12, but I need to double check and just make sure that didn't change over the weekend.
And then here's another question. What, if any, restrictions have been placed on inmates' movement and accessing resources such as education and the commissary?
So right from the very beginning, we had to shut down in-person visitation, and that was very early on at the onset of the shelter-in-place order. So that's been impacted. Certainly the inmate programs have been impacted. Our programs manager is just reported today they've put together I'll call it a distance learning, because we're not doing in-person classroom things with the inmates right now. So they've constructed a distance learning program where they're going to give inmates the work material, study guides, and education packets that they can work on still in their cells, and then they'll turn those in. But it's done much like any other remote learning.
And then were there changes in the commissary or in food service?
So in food service, yes, because typically we have inmate workers as a part of a vocation program. They learn safe food handling, and they learn how to prep and deliver meals. It's one of our vocational avenues for inmates that are in custody. So they're typically very involved in food service in the jail. But once we started seeing cases and we shut that down, just because we didn't want a group of inmates going from one housing unit to the next, to the next, to the next, and run the risk of increasing the spread from a unit where there were positive inmates to a unit where there weren't. So we've worked with with Aramark, who is our contract food service provider, and we're now using Aramark employees for the delivery of meals. We also went away from the traditional food trays that typically go out and then they come back and then they get washed, but we just didn't want to have all that exchange. So we went to a single serve clamshell holder, and that's the bulk of the changes for food service.
Thank you. And then fortunately we have Dr. Moreno on the call, and I have a question for you, Dr. Moreno. How, if at all, has the county responded to the July 23rd state guidance on testing priority? Has anything changed at local testing sites? And this is a long question, so I'm going to break it up into 2 parts, and that's the first part.
So yeah, thanks. Good afternoon. So I don't have information on Optimum, but maybe Karen Smith, if she's on, she might have some information to see if they had made any changes there. But as we have our regular meetings with our hospital representatives and hospital leadership, we work with them to strategize how they might be able to implement the priority testing. So that is something that they can convey to their healthcare providers at the hospital and any clinics to make sure that they are aware of the priority list and the different various tiers. And then as far as the commercial labs, I unfortunately I don't have any control of the commercial labs, and I don't know whether LabCorp or, for example, has expanded on the prioritization of specimens that come in to put any specimen that's identified, could be identified as a tier 1 in front of specimens that come in from individuals that would be lower tiers. That's something that I don't have that information, so wish I could be more help.
Great. And then here's the rest of that question. Can the county continue testing everyone without prioritizing and not negatively affect lengthening or even just not improving the testing backlog, the reason which it seems to be the reason for issuing the prioritization guidance to begin with?
Testing without prioritizing. So our county public lab isn't, again, we are limited to a few hundred per day. So that is really the only testing the county is doing. All the other specimens that don't come to us go to the commercial labs. And again, we don't have any control over the commercial labs. So, so speaking strictly about county testing, the only organization that's county in the county organization's testing is our public health laboratory. We do have healthcare providers who are collecting specimens, and some are doing testing in-house, and those are primarily the 4 hospitals. And then just about everything else goes out mostly goes out to the commercial labs. So that's just a reminder of the county's role in actual testing. In terms of collecting specimens, we have quite a few providers now that are collecting specimens, which again is different than the actual testing. In terms of this question, I guess that I'll take county to mean a community of healthcare providers and laboratories test everyone without prioritizing and not affect the turnaround time. I think or as it's referred to, the backlog. And that is, I think where we're at right now, knowing that there are the demand for testing in our commercial labs exceeds their capacity to the degree that it takes several days for them to return the test. I would say that prioritization is a familiar strategy in public health, and that is that when the resources, when you have scarce resources, and scarce is a relative term, meaning that the resources are can't meet the demand, then there is a very common strategy is to triage and prioritize to make best use of the resources, and prioritizing the collection of the specimens and then testing of the specimens. So that's a provider responsibility and the lab responsibility. It's a shared responsibility. Can assist in making sure that people that really need to have a test result and get theirs returned quicker than those who don't necessarily need a test result and are just maybe curious to see if they've acquired the virus yet. And so those are going to continue to be our symptomatic patients in our hospitals, and also the specimens coming from select outbreaks, primarily in our skilled nursing facilities. And then outside the skilled nursing facility, it'll be, we'll do our best to continue to run the test for jail inmates, another congregate situation, and as much as possible, homeless shelters, which is another congregate living setting. So I hopefully that was helpful to whoever asked.
Thank you. And I think there are some follow-up questions which we'll get to in a little bit, but then I'll take the questions that are coming in. Dr. Moreno, can you share any further information on the 4 deaths over the weekend? And is 4 deaths in one day, or 4 deaths reported in one day, a significant surge?
So I apologize, I don't have information on the individuals that were reported over the weekend. I might be able to text and get a response before we finish up here. And as far as reporting of deaths, we may report 4 over the weekend, but doesn't mean they all died over the weekend. And as you recall, we don't talk about actually when these people died, in order that we protect or do our best to protect their privacy. So I think overall, if we look at these that were reported and deaths that have occurred in Monterey County, we continue to see the impact of a pandemic in Monterey County, and that is looking at the morbidity and mortality. The morbidity is the best example of morbidity is the number of hospitalizations, and the number of hospitalizations continue to go up. What I hear from hospital colleagues is that they do have some capacity, but the beds are slowly filling up, and as well as they're making maximum use of their ICUs. So that's morbidity, and the mortality is represented in fatalities, and our number of individuals that are dying continues to rise. So that's indicated that there's still serious illness here in Monterey County because of this virus. And so I think the real takeaway here is that it hasn't gone anywhere. It's spreading more. And so as we've all, Maya, you and I've conveyed in the past about prevention strategies still is very important. We're going to slow down, minimize the number of deaths from COVID-19, at least minimize it until we get more studies on effective treatments and hopefully some effective vaccines. We do want to slow down the number of deaths and delay those. We need to continue to use face coverings and wash our hands and stay home unless we absolutely have to leave our houses. And when we do go out, keep 6 feet away between you and people who aren't in your household.
Thank you. I have a question here on alternative housing for farm workers in Monterey County, and I don't have anyone on the call who can answer that. I will forward that question, and then the responses that I get, I'll send to everyone who is also on the call. Going on to our next question, this is a follow-up, Dr. Moreno, to some of the testing questions. What about the state health labs and Optimum site changes? How much has the testing backlog results delayed, affected contact? That's a contact tracing question, sorry. Do we have any information about the state health labs and Optimum site changes? Either Dr. Moreno or Karen Smith possibly might have some information.
I would defer to Karen if she wants to reply, because Karen I think is pretty up to date on what's going on with our testing sites.
So I don't have information on the state lab, so I'm not sure what's happening there. But the Optimum sites, everyone can still make an appointment and get swabbed. Those from our area, those tests go to Quest, and we do understand that it has been 7 to 10 days to get them back. They are working. The Optimum is working on bringing more labs in, and Quest is working on rebalancing so that the samples get spread out more evenly and more so they can get them back quickly. But you can still get swabbed. And I believe they are, from what I understand from last week's state call, that Quest, if the sample is tagged, say a hospitalization or someone in the top tiers, those will run first. But it's not in the swabbing; it's in the back end in the testing that the priority is acted upon.
Thank you, Karen. I think that helps with our previous question.
And then here's a question I had started and sorry, they ran together a little bit. How much has the testing backlog results delayed, affected contact tracing efforts?
All right, so it does have an impact on both the case investigation and the contact tracing. And so when we do have providers who alert us that they believe a patient has COVID-19, and we get a lot of those. They're required to report that to us. What we're really looking for is the confirmation, so we're clear as to whether it's the appropriate test that was done to confirm it, or was it an alternative test that we identify as a probable case but not a confirmed case. So once we get that lab report in, then we know what we're dealing really with. We're really sure what we're dealing with. And then if it takes 3 or 4 days for the lab to be performed, the test to be performed, and then another day or 2 for the laboratory to report to us, those are some days where we haven't been able to contact the individual. But as long as our providers continue to follow CDC and CDPH guidance. They will be informing people who test and who have symptoms that they need to isolate while they're waiting for the test result. So if that's done properly and people adhere to the guidance from their healthcare provider, then when we get a hold of them, and this happens, they will confirm that, yes, I've been in isolation ever since I left the clinic or the hospital, and I haven't left my house, and I haven't been around anyone. So that's really what, when we hear that, we're very pleased that the communication was clear. Apparently it was clear from the provider who has collected the specimen. The individual understood what they were supposed to do, and so then we can move on to the contact tracing, or we can confirm when their last day of isolation will be. And then we also move on to the contact tracing. So sometimes our providers will actually collect names of close contacts. And when we get that information, that kind of gives us a head start. So when that's done, that we appreciate that as well. But yes, the longer it takes for a laboratory to run the test and get us the information, there is a potentially longer time for us to respond. There are instances where we get, I'm sorry. And so this is again a reason why prioritization of testing is important. So we don't want to wait 6-7 days for results for jail specimens to be run. We want those right away. So our public health laboratory continues to follow the tiered prioritization list, and those instances or those settings where we need quick response, we're going to continue to prioritize and run those in our own laboratory.
Thank you. And then a follow-up question to this overall testing about backlog and results delay affecting efforts. What about pop-up sites and the MPC testing site? Perhaps this could be related to our own health department pop-up sites that we're doing in collaboration with VNA. Would this delay affect those as well?
I'm not sure I understood the question. Mia?
So the question was about changes and delays. Would any of these affect would those delays and changes affect pop-up sites and the MPC testing site? Well, we don't have oversight over some of these pop-up sites and MPC. We do have our own health department VNA collaboration.
I apologize. I'm not sure I understand the question, but as far as turnaround time for the VNA, the county and VNA testing, the turnaround time is not too bad. I think it's a couple of days at this point using, I think it's Westpac, it's somewhere in Southern California. So the laboratory. So the turnaround time has been fairly good with the county's VNA pop-up sites. As far as Marmonte, I apologize, but I'm not familiar with how long the turnaround time is with Planned Parenthood Marmonte.
All right. And then do all people need to isolate while waiting for test results, or just if you are symptomatic? And could you clarify which test sites use the county health lab and which use commercial labs? Sure.
So anyone who's symptomatic, whether they get a COVID test or not, should stay at home while they're sick. If an individual has symptoms and they're going to go get tested, then that person probably suspects that they might have COVID-19. And in that case, it really should stay at home for a full 10 days until they get their test result back, and if it's positive, stay in isolation until someone from public health contacts them. So someone who has no symptoms and has no symptoms and hasn't been in contact with them with COVID-19, who's just curious and wants to get a test, I would say it's not as important for that person to isolate. They just decided one day to go get a test. It doesn't suddenly make them infectious because they decided to go. So it's important for people to understand that it's not so much whether you get a test or not that means that you have to stay in isolation. It's your symptoms. So if you have symptoms and you're going to go get tested, you do need to should stay in isolation. If you have symptoms and you talk to your healthcare provider, and your healthcare provider says, you know what, based on what you're telling me, it sounds like you were around a family member, a household member who had COVID-19. Yours got sick within 14 days. You probably have COVID-19, and you may not need a test, and just stay home and isolate yourself for the 10 days because you most likely have COVID-19. And so there are instances where people should isolate even without a test. And that example I just gave is another important reason why we highly encourage people to, if they're not feeling well, to call their healthcare provider. The person doesn't have a healthcare, because a healthcare provider knows that individual in the family better than an emergency room physician, for example, and can think on a case-by-case basis, give the best advice as to whether or not someone needs to isolate, stay home from work, and get a test or not get a test. If someone doesn't have a healthcare provider, they can also call the COVID-19 hotline at SVMH and the hotline at CHOP. And I just last week I called both hotlines just to verify again that they are giving health advice. They are giving assessing someone's symptoms and determining whether or not they should stay at home or whether or not they need to get in touch with a healthcare provider or seek services at an emergency department. The other question, Maya, was, what was it?
Can you clarify which testing site, which test sites use the county health lab and which use commercial labs? I'm not sure any of the testing sites use our public health lab.
Yeah, so there's specimen collection sites are in which people, we all refer to as testing sites. Some of them can do send some of their swabs to our public health lab. So that would include primarily our 4 hospitals. And then if we have an outbreak and it's in a location that's high risk for rapid transmission, or there's a lot of high risk individuals who could have higher risk of morbidity and mortality, which is serious illness and death, then we will work with those sites to receive the specimens. And then the current example is the jail here in Monterey County. So it's consistently we get tests from the 4 hospitals, and then other than that, our laboratory is primarily in receiving specimens in response to select outbreaks.
Thank you. And then will the July 23rd state guidance on testing prioritization result in less community testing?
That's a good question. So prioritization of testing is in itself not necessarily intended to deny someone a test. What it does is it identifies, when done properly, identifies which individuals in Monterey County are in need of a quick turnaround time, because there is an important decision that needs to be made that impacts that person or other people. And so in prioritizing, we may find that, well, we do know that people who are in the hospital are prioritized. They get sometimes the hospital may make a decision to run use their resources in the laboratory to run a same-day test, which will come back in a few hours. So hospitals are already prioritizing. If it's a low priority at the hospital, then they can send that to Quest or LabCorp. So there is already some prioritization of resource for the purposes of allocation of resources going on. But the guidance does not require that a provider not test somebody, but a provider can recommend not to test somebody if in the provider's clinical opinion, a test would not add any value to the care of an individual, nor would it affect a decision that needs to be made if the clinicians decided that this person has symptoms of COVID, they've been exposed to COVID, and they need to isolate. A positive test wouldn't necessarily change that decision. And a negative test may not change the decision either, because there's false negatives, and the provider's decision will be the same regardless of a test result. So that's not because of limited resources. That would be just based on the clinician's opinion and recommendation.
All right. If the purpose of state guidance is to improve response times, how do you do that other than reducing overall testing?
So the guidance is intended, I believe, to reduce response time for those who need a quick turnaround the most, and which I've mentioned this afternoon, Maya. I think one of the ways that is just one of many strategies that are involved with testing people for COVID-19. The other strategies include increasing capacity of commercial labs to perform the test. And if the capacity increases and the demand remains relatively stable, then the turnaround times should decrease. So while prioritization is one strategy, there are also parallel strategies that need to continue in order for the entire testing, suspicion, submittal, and testing process here in California to be more efficient, more informative, and more effective in slowing the spread of COVID-19.
And there was a kind of a second part to this question that came in, and I'm sorry I didn't ask it at the same time. So the original question was, if the purpose of the state guidance is to improve response time, how do you do that other than reducing overall testing, especially since the concept of community testing is to track the asymptomatic spread of the virus?
Yeah, so even people who are low priority or lower tier so far can still get tested. They won't be priority testing because if you're having to choose between someone who's being admitted and about to be intubated and needing a test result for the hospital needs a test result, comparing that to someone who's hasn't been exposed, has no symptoms, the choice is going to continue to be prioritize the test. The specimens coming from the person who's about to be intubated. So I took two examples from two extremes on the spectrum, but just to make the point that we are doing it and we'll continue to do that in Maya. I think it's important that I guess what I would want to share is that it's important for people to understand as well is that if you haven't been exposed and you have no symptoms and you get tested and you're positive, the recommendation is to isolate for 10 days from your positive test result. And the recommendation continues to be that a person is considered in that situation infectious for 2 days prior to their positive test result and for 10 days following the positive test result. And so that's still the recommendation. It hasn't changed very much. And so if you have a positive test result and you don't have any symptoms, you're presumed infectious. Even though you might have been infectious, you might have had an infection maybe a month prior to your test date or 2 months prior to your test date. And that's because some people who are test positive while they're infectious can continue to test positive for 2, sometimes up to 3 months after their initial infection. So people need to keep that in mind. If you test positive, you're still going to be need to be in isolation.
And state guidance seems to suggest asymptomatic testing should wait until after results are available within 48 hours.
Let's read that one more time, please.
Sure. State guidance seems to suggest asymptomatic testing should wait until after results are available within 48 hours. And do you agree? Is that the state guidance? Can you explain that a little bit?
I'd have to go back and read that again, Maya, to better understand that portion. I apologize. So I'll pass on that question. I'm sorry.
Okay. That is the last question that we have in our chat. Are there any other questions for either of our presenters today? Seeing none, that will wrap up our briefing and our next briefing.
Mia?
Yes.
Mia?
Yes.
I did want to respond. Thanks for, now that the question's over, I just want to respond to a question that came in last week and a question that came in today. Last week, there was I think it was a question as to whether or not someone who repeats, has repeated positive tests, are included in the data that's reported at the local level and the state level. So what Christy Mishi shared with me is that those are deduplicated, which means that once you test positive, any other positive tests are marked as previously reported and aren't included in the calculations for the data. So that's a question I was able to follow from last week. And then in terms of the 4 deaths, the 4 recent deaths that we posted, all 4 are adults, and 2 of them had underlying medical conditions that increased their risk for morbidity and mortality, and which is severe complications and death. And 2 of them are adults that did not have underlying conditions. So we continue to see what we're seeing here is consistent with what's being reported at the state and national level, that people with underlying medical conditions are still at greater risk of complications and dying. But we still have people who are otherwise healthy who are dying from this virus. So we're all started this pandemic vulnerable to this virus because it's a brand new virus and none of us have ever seen it, been exposed to it, or fought it off before this pandemic started. So it's still really important, even if you're in great shape and you're in good health. Those type of people are still getting very sick, and some of us are dying. So please continue to implement prevention strategies.
Thank you, Dr. Moreno. And no other questions, so we'll let Dr. Moreno have the last word and wrap up our briefing today. Our next briefing will be Friday. We'll see you then.
All right, bye, ma'am.
Bye.